Got belly fat? If you do, well, what kind and why should you care? Well, belly fat, meaning your waist circumference, not just that pinch the inch stuff, that reflects subcutaneous fat, or the fat that's just below the skin. Now, we don't really like that fat, but it's not as dangerous as the visceral fat. And the visceral fat is the fat that's in and around your organs. And that is a problem because it's very inflammatory. And as you may know, inflammation is really the playground for all of your chronic conditions, these metabolic conditions like diabetes, heart disease, even cancer. Inflammation is pivotal in all of those things that 90% of our healthcare dollars go towards, that are primary causes of death and disability. So looking at your waist circumference and specifically noticing if your waist circumference is more than half of your height. So let's say you're 5'6", or 66 inches tall. If your waist circumference is more than 33 inches or half of that, you should really be paying attention to this. So why is that? Well, the visceral fat that goes in and around your organs, reflected by that apple shape that none of us really like, is driving so much of this metabolic concern, this inflammation. And why is that? Well, once you spill over from your subcutaneous fat, that pinch and inch fat, and you maximize your storage potential there, okay, then it starts spilling over into visceral fat, and it goes into the liver, where you get fatty liver and you get insulin resistance. It goes into the muscle, where again, insulin resistance. What does that even mean? It means you're not pulling the sugar into the cell to utilize it as fuel. So it makes your pancreas have to secrete more insulin, throwing more insulin at it. And what does that do? Stores more fat, right? And you've already exceeded your storing space. So it's going more into the organs. And this is just this exacerbation of this process. It goes into your blood vessels through the form of cholesterol, raising up your triglycerides and your LDL, your quote, bad cholesterol, driving more of that heart disease risk, narrowing of the arteries. It even goes into your brain, right? This is fat within the neurons, and there's a really high link between insulin resistance and cognitive dysfunction, like Alzheimer's. It goes into your pancreas, even further disrupting the pancreas's capability of producing enough insulin to bring this sugar down. So this process is going on years, in fact, more than a decade before you'll start to see your sugars go up. And then, so you must be asking two questions. Well, how big is my storage container? That is, when does my subcutaneous fat start spilling over into visceral fat and driving this process? Well, the size of your container is called your personal fat threshold. And the likelihood or when you will spill over into that metabolic process is variable. Genetics go into that, right? People from Southeast Asia or Latino descent have a lower threshold, or that is a smaller bucket before it starts spilling over. The other question you might have is, well, what can I do about it? And that's the power of lifestyle medicine. There is so much you can do about it. You can move your body, exercise, you can build more muscle. This helps you fight and bring down that insulin resistance. You can eat a diet that combats that inflammation from the visceral fat, that lowers inflammation, that helps to support your microbiome to reduce inflammation, that is full of fiber and complex whole foods, not a bunch of processed foods, to help stabilize those sugars and help fight that insulin resistance, lowering the saturated fat and the process that's contributing to that process. And you can stress less, because if your cortisol is driven up, well, that leads you to store more fat. You can sleep well and prioritize your sleep that you need so much, because we drive more insulin resistance when we don't sleep well. You can connect to a community, to your tribe, rather than disconnect through things like alcohol or smoking cigarettes or things that are going to further exacerbate that inflammation. There's so much power that you hold to fight or even reverse this process. So get you some lifestyle medicine, baby. I hope this helps you.